Real quick on cardiovascular health. What are the benefits? Does anybody know the benefits? Let me go over some of the benefits of cardiovascular health. The benefits include increase in cardiovascular fitness, increase in increase in muscle strength and flexibility, improve in joint mobility, decrease in stress level, improve posture and coordination, strengthening bones, decrease body fat levels, prevention or management of disease, and reduction of anxiety and depression. Specific health issues with cardiovascular is people that are obese and, of course, the weight control.
Hi everyone, Dr. Naveed Shah here, and before we get into the video, I want to tell you about this video's sponsor, the Delta V. Delta V is the all-in-one lung training solution with adjustable airflow. Whether you're recuperating from a respiratory ailment, rehabbing your lungs, eager to boost your lung capacity, or dedicated to cultivating optimal lung health, Delta V stands ready to accompany you every step of the way. Visit our website, deltav.rehab, or call us at 410-871-4601 to order your Delta V today. Now let's get into it.
There was a common misconception that cycling that bicycling can cause a heart attack or exercise can cause a heart attack. I know a lot of people fear, especially if they have a heart attack, when the doctor says don't do as much exercise. That type of phrase and that type of wording should never be in place, just because when somebody has a heart attack, there is some contraindication on some exercises. But the exercise itself, what constitutes as a good exercise is something that increases your heart rate. But we don't want that heart rate to go overboard. So what do? We in place target heart rates during your exercise. So exercising is necessary, especially if you have an MI, myocardial infarction, or a prior myocardial infarction. So exercise routines are incredibly important. Now, how much bicycling should I be doing per day? You want to try to get to at least 25 minutes a day. That's what you want to try to. I can't do it. Well, like I said, you want to try to get to 25 minutes a day. If you can get to 25 minutes on a bicycle, going at a good steady pace, you don't have to go vigorous. You don't have to go, you don't have to be too ambitious. But, adding some exercise like that to increase your heart rate will do nothing but benefit you. Cardiovascular disease, including stroke, high blood pressure, and a heart attack, regular cycling stimulates and improves your heart, lungs, and circulation, reducing your risk of cardiovascular disease. Cycling strengthens your heart muscles, lowering resting pulse, and reduces blood fat levels. Research also shows that people who cycle to bicycle, so that's what it means by cycling, people who cycle to work have 2 to 3 times less exposure to pollution than car commuters, so their lung function also improves. Cancer research has shown that if you cycle, the chances of bowel cancer is reduced. That's interesting. Some evidence suggests that regular cycling reduces the risk of breast cancer as well. Cycling also improves strength, balance, and coordination. It may also help prevent falls and fractures. Riding a bike is an ideal form of exercise if you have osteoporosis because of its low-impact exercise that places little stress on joints. Mental health. The mental health conditions such as depression, anxiety, and stress can be reduced by cycling regularly. This is due to the effect of exercise itself and because the enjoyment of riding a bike can bring. So things to remember. Cycling can help protect you from serious diseases such as stroke, heart attack, and some cancers, depression, diabetes, obesity, and arthritis. Riding a bike is healthy, fun, and low-impact form of exercise for all ages. Cycling is also easy to fit into your daily routine by riding to the shops, parks, schools, or around your neighborhood and work. Okay. Now, if you have any concerns, you always want to talk to a cardiologist and talk about cardiac rehabilitation and what are my limitations on exercise. Get that information because they're going to look at your target heart rate. They're going to look at, okay, this is your target heart rate. I want you to stay at, 54 beats per minute to 110 beats per minute. They're going to do something like that. Instead of saying just cycle until you pass out. That's obviously not a place you ever want to go to.
Hi everyone, Melanie here. Check out the HRN store by using the QR code on this video, or you can click the link in the description below. You'll find everything you need for pulmonary rehab there. So take a look.